Israel says it's going to block more than 24 NGOs currently operating in Gaza, saying they have failed to comply with new registration rules that charities say felt dangerous and a risk of being directly targeted, as Israel has killed hundreds of aid workers in Gaza since the start of the war. Well, aid organisations worry that the new ban will only further harm the civilians who are in desperate need. Since a ceasefire was announced, bombings have continued and Israel still refuses to allow vital aid into the region. Well, to get more insight into the situation there today, we can cross now live to Gaza and speak with the emergency coordinator at MSF, or Doctors Without Borders, Claire Nicolet. Thanks so much for joining us, Ms. Nicolet. We're seeing pictures of, this lack of housing, this lack of shelter in really harsh winter conditions. But can you tell us more about what is the situation there today for Palestinians in Gaza?
Yes, so we entered the third winter in a row that it's really complicated for the population in Gaza. Indeed, most of the population is living inside tents, makeshift shelters, but also very destroyed buildings that they are still living into. And unfortunately, with the current weather, there are buildings collapsing. So we have seen a few deaths because of this. People are losing what they have, meaning that their tents also are being lost with the current situation and with the wind. And unfortunately, we are even starting only to see the rains and the floods, because January and February are known for being the worst period. So we can just imagine that this population is already suffering from the situation with lack of everything, basically, will continue to be in a more terrible situation because of the reality of the weather as well.
And Israel is still blocking vital supplies, even things as simple as tents and shelter equipment.
Unfortunately, yes, the entry of the goods and the very vital goods, hygiene as well, shelters, are really coming slowly. So unfortunately, this is not covering the 2 million people here in Gaza, and it's really difficult to really give what the population is in need. And unfortunately, indeed, there is even more loss of shelters with this situation and with the weather. So it's really not at scale at the moment, the entry of goods inside Gaza, and really us as humanitarian, we are not able to respond to the needs, really.
Now, as you are, of course, with Médecins Sans Frontières, or Doctors Without Borders, give us an idea on the medical side of things in terms of supplies and even the range of functioning hospitals. So many were directly targeted and put out of action. I read that one hospital that was partially functional is actually now at the other side of this yellow line. Can you tell us more about the medical situation?
Yes, indeed. So the problem is that already the health centers, the hospitals, most of them, they are not functional or partially functional. So it means that none of the hospitals today in Gaza are really functioning like they used to be. And obviously the needs increase tremendously. So it's really very difficult for the population to indeed take healthcare. And unfortunately, we are really treating the more severe cases. Indeed, two of the main hospitals now are further the yellow line, so they are not even operating. So Gaza City, for instance, there is less and less possibility for the population to seek for healthcare. So obviously, we do operate. We are continuing to open clinics to support hospitals, but the problem is that indeed also the supply we are receiving it's quite low. So we are not able to do what we could do with better material, better quantity. And so basically, we are always running beside the needs, and we are really not able to provide to the population, provide to this very hurt population. Because, for instance, in terms of trauma, we are speaking about 5,000 to 6,000 people being amputated. So these people, they will need very long-term support and care, and this is not really possible at the moment to give the full care they are needing.
Before we discuss that possibly a bit further, can you tell me more about this yellow line? I mean, we're hearing from Israel that they will shoot anyone and indeed have even children that approach it, but it doesn't sound like it's a clear line in Gaza. How does it work, and where are the Palestinians currently living, forced to live?
Yeah, so the first thing which has a very direct impact for the population about this yellow line is that it's more than 50% now that is not accessible for the population. So already the Gaza Strip, as we know, is very small, and now it's even half, not even half of it that where people can live. Then exactly what you mentioned, that if people are getting close to the yellow line, which is not clear and which is also moving, by the way, they get shot at. So, for instance, yesterday night we had a girl and the women that were close to the area and got shot again next to Gaza City. So this is the ongoing issue that every day the population is facing. And also this yellow line has been moved several times, and it means that the territory is smaller and smaller, and even forced displacement happened last week, for instance, that Israeli authorities requested some population to move from their neighborhood and of course to be pushed, and so it means also the population is really in a very, very tiny part of the Gaza Strip now.
And we're hearing, of course, from Israel's side that it's looking to hamper aid organisations even further. Can you give us just an idea of the extent of what aid organisations are doing today? I believe MSF supports nearly a third of the births in Gaza, so many, 20% of what's done in hospitals. Can you give me an extent of what is done by the aid organisations so I can get an idea of the impact that would have?
Sure. So yes, indeed, most of the hospital and the healthcare center, if we want to take, for instance, the health part, is supported by organizations. So basically, there is almost no today public system working. So single thing is supported indeed by the international organization. This is true for the healthcare. This is true for the water, obviously, because we are distributing as MSF and also as the humanitarian community most of the water of the strip. This is true for the food, because of course there is emergency food brought to give to the population every day. This is even true for the trash, because trash is also collected with support of organization. So it means that basically today the majority of the basic needs are covered by international organizations.
And finally, Ms. Claire Nicolet, you spoke there of the trauma of a people that have lived in war for over 2 years now. I mean, the situation is ongoing, but is anything being done to try and help people process the horrors that they've had to live through?
So obviously, this is one of the major issue, this trauma, and how we can support that. And unfortunately, they are still in this trauma now. They are still living this insecurity, because of course there is this ceasefire, but we still. At the moment we were discussing, I just heard a big explosion. So, it's not like it's over and we can start really rebuilding. Even, I mean, for trauma and for mental health, that tomorrow is already moving. So, of course, we continue to support, but once more, unfortunately, we are really seeing a very small part of the reality of the needs, and that we can really support. So trauma is everywhere, death is everywhere, unfortunately here, and we are just doing a very little part today, and maybe we'll have to do even less in the coming weeks and months.
Claire Nicolet of Médecins Sans Frontières, Doctors Without Borders in Gaza. Thank you very much indeed for bringing us more insight.